very emotional day. I think it was just to get the push notification from the hospital that I was on the list, and I was able to go in. Was super excited. I took the first appointment I could get. It's something that 6-8 months ago we didn't think was going to happen this fast, and we realized how important it is and how positive the data looks. So I feel very privileged to have the opportunity to get the vaccine. I would reassure them in that the vaccine has been studied in over 60,000 people. If you look at the data, it's unbelievable to be 94, 95% effective at preventing severe disease. As far as we know so far, they look very safe. There's no conspiracy here, no microchips being injected or other things. So this new technology is completely different. They're called mRNA vaccines. So it's a messenger RNA. So your body has DNA and RNA in it. And mRNA helps your body or tells your body how to make a protein. So this is not going in and altering your DNA in any way. It's basically telling your body, hey, you need to generate this, what we call spike protein, that is specific to the SARS-CoV-2 coronavirus, the one that causes the COVID infection. So there's 0 virus particles in this. It's actually just a protein. It helps create a protein in your body. It doesn't give you the virus in any way. And what that does is that protein is like what we call an antigen. So your body will generate an immune response to it. It doesn't like this spike protein that's been developed. So your T cells activate, and it tells your body how to create antibodies to fight this infection. Anytime you do something for the first time, there's a lot to learn. So the first wave was scary. These people were really sick. We were using a lot of our intensive care unit resources, and everyone was very scared about transmission to the healthcare providers, and we had a lot to learn. Our intensive care units were full. Our hospital beds were full. We were short on PPE. We were short on medications that we needed to treat these patients that were on, many of them on life support. We didn't have the right drugs. We didn't know what was the right pharmacotherapy. So I, as a critical care pharmacist, working with our infectious disease pharmacist and our pulmonary critical care physicians and nurses and respiratory therapists, we were taking the data as it came to us and trying to come up with the best treatment approaches. And we were helping the physicians guide. And a lot of these medications had toxicities. They do something called prolong your QTC or cause other problems that can cause cardiac arrhythmias or other side effects. So we were helping manage that and try to give the best therapy to these patients. We're way more prepared. We were a major referral center the first time. Now I think the wealth is being shared a little better, and we've done a better job of spreading out the resources across the state. And we have newer, better therapies. So now we have potential therapies, antiviral therapies. We're using a cocktail of a variety of things, including dexamethasone or steroids to help with the breathing. We've got new techniques that help people oxygenate better, and we can keep people off the ventilator, keep people off life support, keep people from needing to go on a medically induced coma and decondition in a bed for weeks at a time. We've already incorporated COVID-19 into our curriculum. Just some examples of that. I think everyone thought that the critical care piece was going to be like the key, and the really sick people were going to need excellent critical care. We've seen that now the outpatient piece is probably the biggest and most important piece from a pharmacy standpoint. The importance of the M-Care pharmacist and the community-based pharmacist is huge. When I went to get the vaccine this morning, our operations manager Ganesh, he was there. Our pharmacy was drawing up the doses. You have to take the vaccine out of a -80 freezer, reconstitute it, and draw up. We were doing 1,600 doses today in the clinic, just at our hospital. Pharmacies have always played a huge role recently in vaccinations because patients can get to the pharmacy, talk to a pharmacist, and get care without having certain appointments or a certain type of insurance, which makes you go to one versus another. So they're the most readily available healthcare provider in the community. And they're also one of the most trusted. So I think the patients are going to come to the pharmacist with lots of questions. And in particular, this is going to be an important piece in the rural areas. You may not have a medical clinic for a long period of time, but usually there's a pharmacist in your town, an independent pharmacy or something else. And the pharmacist will be there, be able to answer these questions, be able to counsel the patients, give them confidence, and then ultimately be able to give them the vaccine themselves. So from that standpoint, I'm really proud to see pharmacy step up in this whole process, take the lead. And it's the FDA, the CDC, the Public Health Department, and the hospital organizations have all entrusted the pharmacist to take this role.